Good morning again. I'm Lee Thielen, and what wonderful welcomes we've had this morning. Those were terrific. I have the pleasure of introducing Mary Selecky to you. And first of all, if there's anybody in this room who has not heard the name Mary Selecky, that's fine. You'll still understand why she's our speaker, because you know Washington State. And you know what they've been doing over the last 8, 10 years, maybe 14. And it's been setting up standards that the rest of the country has been learning from and enjoying and often being mentored by the folks from Washington State. So we chose Mary for our speaker for, I'm going to say many reasons, but I'm going to talk about 3. And those are leadership, vision, and wisdom. As many of you know, Washington State was among the first to set up state standards and monitor those standards with an objective process over time. Sounds a little like accreditation, but they were doing it a long time ago, and they've been following that progress and what that meant. They've also set a standard on what the state does, the locals do, what the locals do, the state does. We don't tell you to do something that we're not going to do ourselves. Any state that doesn't do that? I've heard of a few. Now, of course, Washington State was one of the first states to be accredited, and they are, again, setting a great example. They also have innovative ideas, such as 3 centers for excellence that work with all the agencies in the state and local agencies, to continue their improvement in quality and in performance management. Other examples of her leadership are she has really been on the ASTHO board for as long as she's been a state commissioner, as I recall, which is 14 years. And she was president twice. She's also been on the NACHO board in the past, because she not only has had 14 years as state health commissioner, she also had 20 years as a local health director, which may speak to why she understands so well that relationship between state and local. She's a visionary, always sticking to her principles, but keeping her eye on the ball, keeping her eye on the big picture and how to improve the public health system while improving the health of the people in Washington State. Wisdom. Do you know how few people in this country can be a political appointee under 3 governors? It's almost unheard of. The average tenure of a state health officer that's politically appointed is 2 years. They don't even make it under 1 governor. And Mary is appointed by 3. And she's leaving of her own accord, which is another thing, too. And I'd also like to mention that she's going to be in the game with us for a while. She is one of those key people who are on the FAB accreditation committee. And although bad news for Washington State, she will not look at anything you send in, any of the local health departments, because they have very strict conflict of interest in ethical requirements. But I'm glad that she's continuing with that. So again, Mary is a person who can translate all that we do and all that we know into a vision and a language that policymakers understand, that the public can understand, and takes that leadership has taken it not only in Washington State, but nationally. Mary, we're really pleased that you're here today.
Well, thank you, Lee. And it's really nice to have time, and I do admit that, to spend a day just sitting and listening and learning. That hasn't happened for these past 14 years. I'm in and out, just like the mayor did, just like the commissioner's going to stay for a while, and his son, he's not hurrying up, but I'll try to. Can we adopt your mayor? I mean, I have a feeling there's a whole bunch of us who would love to have your mayor, Commissioner, and thank you for taking care of us while we're in your city. I always remind folks when we're in Washington State, I'm looking out for you every day. And that's what public health people do, because that's an easy way to get them in the game. You know, public health is easy to fall in love with. You just have to learn about it. Just think about how that mayor spoke. That was from the heart, not from talking points. That was from understanding what we do, and that's rare. I want to say congratulations to the National Network for this informative forum, because really, it's been a great learning experience so far, and you've got more to come because you've got these interchanges at the round table, so don't skip out and grab that early plane or grab the car and get out of here. And 3 cheers, and all of you, I'd love you to join me. Hip, hip, hooray. Hip, hip, hooray. Hip, hip, hooray. Hip, hip, hooray. With me. Hip, hip, hooray for those 14 accredited organizations, because it's a lot of work. And to all of you who are in the process, just keep at it, or just do it, as it were. And I do need to give a shout out to all my colleagues here from Washington State, both state and local, and other organizations and folks who live there. So as I looked at the title I was given for this talk, reflect on the title, Blazing the Trail, I too looked it up. And it means to do early or pioneering work that others will follow upon, or to do something which will be important and useful to other people. On that second one, if just one person learns something from somebody else, you feel good about that. And hindsight's a wisdom teacher, so to hear Lee talk about our work now feels very different than when Pat Libby and I were approaching the legislature many, many years ago to say, we have this idea, and do you think you would get behind us and work with that idea on us? So this is one state story that includes our State Department of Health, local health jurisdictions, and now continues to be reviewed by our tribes. So let me just tell you a little bit about Washington State. Some of you were in a session yesterday and heard some of this. We have 6.8 million people. It's becoming more diverse. It's not the same state I moved into 39 years ago. It's doubled in population since I moved there, 1974. And the population looks very, very different everywhere in the state. We've got 2 counties whose Hispanic population is greater than the Caucasian population. And they're in central Washington State. We are Western and Eastern dynamic. Every state has got some kind of dynamic going on. Ours is Western and Eastern, that wet part of the state, and it's not always wet really, and that desert part of the state, but we do have a rainforest and we do have a desert. And we've got the dynamic of urban-rural. Those people who are in that big city take all the money away from us. Ha ha. Rural folks get some support from all of those urban places. We have 39 counties from 2,000 population to 2 million. 35 local health jurisdictions because we have some multi-county. And I ran one of those multi-county health jurisdictions, and it still exists, 3 counties, very, very rural. We have 29 tribes, and we too, like Wisconsin, are a home rule state. This coming of age has been a marathon of many years. Yesterday, somebody asked a question of Diana Erie in the session about how long we were at this, and Susan Ramsey answered with saying 1999, and our quality improvement plan was 2007. But I pondered and think about how much of this really was, while formalized at the turn of the century, sounds long ago, doesn't it? It included foundational work in the last century, in the 90s. Health reform was going on in the early 90s, and we had champions who really worked very hard to make sure that we had health status, not just cost containment, not just access, but health status. And many of you remember Bobby Berkowitz. Bobby Berkowitz, who eventually worked for Turning Point and now is at Columbia University as the Dean of Nursing. Well, Bobby worked at the Department of Health after being at the local level, and she was at the big table on our behalf. And she made sure that health status was included. Public health had a place in the conversation. Now, that doesn't mean that you're there for the first dollar, but you have a seat at the table. That work culminated in what we developed, a public health improvement plan. And it was based on mutual accountability, as you heard, between state and local. Because in order to do this, we needed each other, and we got to understand that. And we actually had a law passed in 1996, and I have a picture of that bill signing. The picture includes Bobby Berkowitz, the then Secretary of Health, Bruce Miyahara, who does a lot of work in Kansas. Pat Libby, Joan Brewster, names you know, they were all part of this important work. And as Torney Smith said from the local level, yesterday he and I were talking, and he said, you know what was incredible about that law? We asked the legislature to give us language that we would have to measure what we do and we were held accountable by reporting to the legislature every 2 years. I think back on it now, and again, distance is a wisdom teacher. That was pretty incredible. But then we had to produce, because a plan is a plan is a plan, but it is about the implementation of that plan. And this was a very different concept for us. As a friend of ours from CDC once said, you people need to get up with it. This is about performance measures now. It's about accountability. You all think you're doing the work of the divine. And when you say we do public health, don't you understand? We do the work of the divine. We are out there in the community, and you can count on us. Well, the question started to be about a different kind of culture that was happening around us. Are you really improving immunization rates? And what difference has it made? How quickly are you following up on reported illnesses? One of our smallest counties was part of the multi-state learning collaboratives. And they said, we do great in our town. We do just, we only have about 12,000 people, and we get a report and we follow up on it. Well, they traced it one day, and there were only 6 people in this department. And they said, it sat in my box, and then it sat in the nurse's box. And then eventually somebody talked to the whatever. So they kind of changed it. It was a matter of taking a look at it and saying, what's that accountability, and what is it we're going to do about it? One of those other questions that we all struggle with, so that health education stuff you people do, what difference does it make? How do you know? And so we really had to look at how it was that we were going to interact with our policymakers particularly, but with the public, and improve that health of people. So we set to work to create rigorous standards. We had lots of discussion. Are these process standards? This is so boring. It doesn't mean a thing to me. You're making me write this stuff down. We know how to do it. All of the kinds of things that I was an administrator for 20 years. I knew how to do my job. And the people around me knew what I did in my job. And if I wasn't there, somebody would know what to do. Well, that's not always the case, and I think that was very humbling for us. So we did make sure that we had the plans. Well, the truth is that we did the work together, and that's what was important. It was all co-led by state and local, with input from many others, whether it's our School of Public Health, whether it's from our tribal partners, whether it's the community. And our federal partners were important in this because, think about where all your funding comes from. And if you're going to change a system a little bit, you've got to make sure that you can still do that nano reporting that seems to be required by those funds we get. How many pencils did you buy? I can't believe we still get asked that question. Well, maybe it's not pencils these days. So we ended up reaching out to find folks who could do an independent review of our local health jurisdictions. And how we found, and aren't we lucky, but Marnie Mason and Barbara Maurer. So they were folks a step away from all of us. They weren't one of us. Now, on the one hand, they were kind of tainted in some places because it was like, they don't know the work we do. Well, no, they're looking at how you do your work. That's a little different view than the content of the public health expertise, how you do your work. And boy, did we learn a lot. And Marnie, thank you so much for sticking with it and also becoming a national treasure for all of us. We did a beta test with 100% voluntary participation of the entire system. Now, I'm not a wonk in that kind of world, and I looked at Joan Brewster and I said, a what? We're going to do a what? No. That just means we're going to go out and try this stuff. Just wasn't a world I was familiar with. Well, how many states in here or local health jurisdictions participated in the national beta test? By then we were kind of used to that. But we did a beta test. And only privately did every local health jurisdiction get the results, and we agreed nothing would be shared so nobody'd be embarrassed, because we had to build that trust that this was going to work and it was to help them. And as a result, it would help all of us. We did it with 100% voluntary participation of all of our 35 local health jurisdictions. There was no money really tied to this. We were very fortunate that in the health reform, we did get an infusion of state dollars. But that infusion wasn't tied to doing this. But I think all of us were learning a lot. I was at the local level at the health reform time. I came to the state in 1999, and we kind of kicked this into gear. And you're hearing the results of all of that. So when this beta test was done, it resulted in a really long list. And our staff were able to see what was going on in the staff of the Department of Health in each of the 35 local health jurisdictions and came up with common themes. And we filled a room, not quite this full, and said, what should we as a system focus on? What should we look at first? So everybody is doing something around this issue. And we came to agreement on a few topics. But every local health jurisdiction did their own individual things in addition. The state programs did things in their programs that they learned. And really, it was about how we do this as a system. And you're building that culture. And little did we know, and the point is that while we didn't use the lingo we use now, we didn't have an accreditation process, we were building a culture of quality improvement in the public health system in Washington State. Once again, I say, hindsight's a wisdom teacher, and it's a matter of looking back and cataloging those things. Oh yes, writing things down again. So let me take a pause for a moment and share some thoughts that I heard Dr. Bill Foege give us at a public health conference. Not once, not twice, but many times I've heard him say these things. He was the head of the Centers for Disease Control under President Carter. He helped stamp out smallpox. He graduated from Colville, Washington High School, where I live. He was there last weekend speaking to our Rotary District Convention, and I wasn't there. I was on the road at a family event. He wrote me a wonderful note last night talking about how special it was for him to invite his three sisters to have a family reunion and visit the church where he was the Lutheran, his father was the Lutheran minister. So we gave him an opportunity, and I will thank him forever for coming back to Colville. Well, he's a public health giant. So those of you who know him, maybe you want to close your eyes, and maybe you want to hear his voice, not mine. Seek the truth. Coalitions are powerful. Trust holds us together. Social will is critical. Social will must be transformed into political will. Effective leadership is critical. Never give up. And be optimistic. I share these words because we need to keep them in mind as we do this work, regardless of our funding, regardless of the time constraints, regardless of the issue of the day. Since 2000, Washington State has been through 3 rigorous statewide reviews of the system, state and local, and we've evolved. When the national standards were developed, we were at the table, sharing and learning. Joan Brewster, Torney Smith, and more recently, Susan Ramsey and her team. We've adopted the national standards, but we have not fully abandoned those state standards. You know the song, breaking up is so very hard to do. You know, it's sort of, oh, I don't know if I want to let those go yet. Let's see how that other thing is. You know? Well, we took the brave step to apply for national accreditation, and who's here from Oklahoma? Yeah. Did Terry Klein show you the picture I sent him? It's a picture of me at the computer pushing the button before you guys did. Yes! It was just a friendly rivalry, you know. Anyway, I'm very proud that I'm part of all of the people in the department, and there were many, many, many people involved, especially in the site review, but in everything that we did about this. So I'm going to talk a little bit more formally for a few minutes, and then I'll leave you with some additional thoughts. So you'll hear me talk a little bit later about this transforming your business practices. You know, we have developed, funding is tough, and I heard stories of other places and how many FTEs are gone and all that stuff, and it's very real, and it's heart-wrenching. And I hated it when the tobacco money went away. And I protected the money went to local health. We took bigger hits at the state so we wouldn't harm the locals, because we can't do our job at the state without you. And it's really important that we can hold on to the system. But boy, if we're doing business the same way, we are dead. So we came up with an idea called the Agenda for Change, and really it was based on 3 major principles. Protect our successes. If we're successful at keeping kids immunized, how do we make sure that happens? Or we respond to communicable disease, or we've got good data that the public trusts. how do we protect our successes? How do we take on the new challenges? That obesity thing and chronic disease, it's not going away, and we certainly don't have best practices in many of those. And the third one is, how do we do our business differently? That's what we're about in the accreditation process, but more importantly, in the quality improvement stuff you take on, regardless of when you do accreditation, and the kinds of performance management issues that you will take on. So it's really important to do that. Using our limited resources wisely, as I packed up to leave the agency, I came across a report from 1940. And it was from the U.S. Public Health Service, came to Washington State, and basically the report was they don't have enough money to do their job. Then a friend of mine gave me a gift as I was partying that she bought at the Seattle Public Library sale. It was a report on public health in the state of Washington in 1920. And in 1920, Washington State was 47 out of the 48 states in funding local public health. So since I've been in public health 34 years, I kind of feel like the movie Oliver. I would just like some more, please. And we'll do good things with it. Doesn't cut it anymore. We won't ever have enough funding to do the things that are expected of us. We heard that already multiple times. But how do we spend the resources we have? One of my buddies said to me, Mary, as secretary, you're killing us with the death of 1,000 cuts. I said, Rick, how much is enough? I can't get more. So how do we use what we have, including the federal dollar? How do we have those conversations with our federal partners? And the fact that we have funds from the federal government to do this work, that the partnership we have with the Robert Wood Johnson Foundation, who believes in this work, we've got resources available. How do we use them? Now, that's a slide from Washington State. And let me tell you what's important about that. We have employee survey data, or we've got our SHA and our SHIP, or your CHA and your CHIP. Today's lingo, it doesn't matter what it is. We have a process that our prior governor put in place called GMAP, Government Management Accountability. If anybody read Rudy Giuliani's book, it's chapter 4, and it's all about city stat stuff. Well, we're all doing it in Washington State, or were in that administration. Now it's called Results Washington Dashboard. That's in the middle under budget. So, the words may change, but how are they all linked? And how are you going to use them powerfully instead of saying, okay, I got that one done, and I got that one done, and I reported to the governor's office or the mayor's office or whomever you reported to, and you haven't figured out how to use them all. So questions like, how well are we doing? How do we collect data? What do we do with it? Is our strategic plan really working? Who's involved? What frameworks are we using, whatever lingo you have, to say we can actually look at this and say, maybe we can pull it together in a different way? It doesn't have to be complicated. This just happens to be all the stuff that we see going on in the department. And I share that with you just to say, think about it a bit broader. Take a step back and look at how you're working. Because when I saw that slide, it knocked me off my socks. I knew about every one of those things individually. But to say we need to look at it holistically, whether you're a small health department or you're a state health department, whether you're regional or you are a tribe who's trying to figure out how it is you'll get the council to look at the public health issues more than just the clinic. Many of those dynamics, those are from conversations that certainly I've participated in. Now, this next slide is going to say questions, but I'm not done yet. So let me share with you, and when I counted them up, I'm going to call them Selecky's dozen. It's a journey without end, with many roads, successes, challenges, and opportunities along the way. Relationships are everything. All else is derivative. That's one of the most important things I learned in my life. In fact, I heard it at an HO meeting a gazillion years ago. Maybe before some of you were born. I don't know. Mutual accountability. As Nancy Young said yesterday, work together really. Work together really. Approach it within the organization, between organizations, within government, and with your community. Dedicate, underline that word, dedicate time to the effort. Don't count on finding it, because it will be lost. from the beginning of the day to the end unless you dedicate time. Dedicate it ahead of time. So slow down. You know, those of you who might have gone through the Kaizen event, slow down. Take a look. Take a breath. And then move to improve. And we don't do that often enough, every single one of us. That great line that I heard yesterday, the boss made us do it. Well, the boss needs to be engaged, lead the effort, and make sure it's inclusive. We heard examples of that yesterday. Collaboration creates support. I heard a question, so what did all those collaborations do for you? And I immediately thought about it, and it was collaboration creates support. Accreditation is the bonus, really, but staff engagement, service improvement, work satisfaction, those are the prizes. Those are the things you get. You've got to maintain a constancy of purpose, and Marnie Mason reminds me that's a Deming principle, constancy of purpose. Establish performance management and quality improvement as a priority. It's not in addition to your categorical programs or the services you provide. It's about how you look at the whole thing. Before you submit, should you be going after accreditation or any other kind of thing like that, get ready. Assess your readiness. Don't push the button yet. Review again. And maybe review one more time, and then push the button. Take your time. You know, as a member of the accreditation committee, we're there. We'll be there. You'll get to us. You know, I mean, you know, those early jackrabbits, and we were one. You saw that little play with Oklahoma. But really, take your time to get there. Embrace the opportunity to transform the way you do business, because it is an opportunity when you see it. Otherwise, it'll get lost, and you'll forget, and you'll really go back to where you're at. And as Kentucky said in a session, get her done. So let me finish with a famous quote written in 1920. It relates to that title, Blazing the Trail. I took the one less traveled by, and that has made all the difference. Thank you, Robert Frost. Enjoy your journey, and thank you, and good luck. Interesting. I was asked that when I was at a meeting in Washington, D.C. a couple weeks ago, and it was an elected official who asked me that question. And I think there are several things. I will tell you. One of them is being the middle child of 7 kids. Now, Les Beich, at a NACHO town hall meeting many years ago, said, working for the state is like being a middle child. The older ones are telling you what to do, i.e. the feds, and the younger ones just want more. So somewhere in there, you end up learning some negotiating skills. So I think that's something that's core in me, and I thank you for pointing that out, Les. Many, many years ago, it was like, oh, should have had a V8. The other one is that at the local level, I was in a very conservative 3 counties, very conservative. And Hawaii is my very first boss. My first job was in economic development. I don't have a degree in public health. It's history and political science. I've learned from all of you. I've studied hard, but I've learned from all of you. But this wise man, who I didn't think was so wise, actually, I thought he was a pain in the butt, he said to me, when you're working with the board, and we had a board of 20-some, it included our 3 tribes in our, this is way early, this is 1975, included our 3 tribes, and included county commissioners from 3 counties, the board was 20-some, local community people, city people. He said, don't label them. Look at them, listen to them, and pay attention, because those are the people who are going to help you implement what you need to get done. He didn't use all of those words, but I know that's what he meant, or I've learned that, put words to it. Kind of was more blunt than that, quite frankly. So working with all kinds of political ilks, living in a very conservative community, coming with some very different kinds of ideas, and learning how to mold those. So I find myself in state government, and I do have to admit there were 3 Democrats, but that doesn't make your job easier. You got a legislature, and in order to pass something, that Republican caucus is as important as the Democratic caucus, no matter who's in charge. In my last week, I was honored by a proclamation from the floor of the House of Representatives. And then I was invited to come down and taken into the Democratic House caucus. So there the conversation was a lot of joking about me handing out condoms all over the state. And I thanked them all for their support and their wisdom and all that. Then the Republican leader came over and knocked on the door and said, we'd like Mary to come in and visit with us. So there the conversation was a little different. We weren't talking condoms. We were talking about how I cared about rural areas and all of the community, and they thanked me for that. So I can't think of a better gift in my public service career of 38 years of being able to walk in and out of those circles. And so, your parents have a lot to do with that too. But anyway, I would say that's that. But some wise listening, but also some wise advisors who said, oh, shut your mouth now. Well, Lee, it's been a pleasure. And I'm not done. I'm around. But you all are our future. You have a lot of shoulders to stand on, but thank you every day for the work you do. Thank you for your dedication to public health. Even though nobody pats you on the back, know that today that I am grateful for what you do. Thank you.